I'm Julia,
I'm Elisa.
and we're doing our infomercial presentation on communicable diseases. So, what is a communicable disease? According to the Center for Disease Control, communicable disease is an illness caused by an infectious agent or its toxins that occur through direct or indirect transmission of the infectious agent or its products from an infected individual via animal, vector, or the inanimate environment to a susceptible human or animal host. Major examples of communicable diseases in public health today. There are over 200 infectious diseases listed in the American Public Health Association Disease Manual. The most prevalent of them include Zika virus, Ebola, dengue, seasonal and pandemic influenza, Lyme disease, and MERS. The epidemiology of the Zika and Ebola virus include the mode of transmission, which is from the bite of an Aedes species mosquito, from pregnant women to their fetus, sex, blood transfusions. Some symptoms include rash, fever, joint pain, conjunctivitis, muscle pain, or headache. The Ebola virus modes of transmission are from the fruit bat of the Pteropodite family, human to human contact with blood, bodily fluids, or secretions through broken skin. Healthcare workers are frequently exposed to Ebola from looking after patients who are infected and being exposed to these items, such as linen or coming in close proximity. People remain infectious as long as the virus remains in their blood. Some symptoms include sudden onset of fever, fatigue, muscle pain, headache, internal bleeding, vomiting, diarrhea, rash, or impaired liver and kidney function. Some behavioral factors include people who are less susceptible People can be less susceptible to communicable diseases by taking more precautionary approaches, such as wearing long sleeves or pants during mosquito season, purchasing clothing that is pre-treated insecticide, using EPA registered insect repellents, using mosquito netting and staying indoors and turning on the air conditioning, abstaining from sex or using condoms during sexual intercourse, keeping up to date on their vaccination, practicing personal hygiene, and use of personal protective equipment.
Some risk factors are high exposure rate to vectors, healthcare workers, nursing home aides, and preschool teachers, economic and social determinants of health, poverty and inequalities in wealth, lack of immunizations, lack of fully functioning immune system, lack of sexual safe practices, and lack of hand washing. Protective factors are um, a simple and or cost-effective interventions is promote healthy living such as education about communicable diseases and risk factors, availability and affordability of medicines and basic technologies, global and national prevention and control, as policies and programs promote legislative, regulatory, and fiscal measures. Susceptibility of communicable diseases. Environmental factors influence the spread of communicable diseases. For example, these are the most important: water supply, sanitation supply facilities, food, climate. Flooding after rains can result in sewage overflow and widespread water contamination. Social and personal consequences. Death from infectious diseases occur in developing countries because of emergence of drug-resistant strains of diseases as TB and malaria. Economic impact for new health dangers. Communicable diseases claim more than 14 million lives a year and account for about 80% of the difference. Communicable diseases can be spread with across international boundaries by airplane passengers. Poverty and poor health play an important role in the spread of these diseases. Consequences are loss of appetite, coughs and sneezes, diarrhea, loose bowel movements, exhaustion, nausea, and vomiting. Future challenges to the control of communicable diseases are public health is a highly neglected area, problem with surveillance system, infection, outbreaks in hospitals, and strategies to avoid them, hand washing and alternatives as fast antiseptics, risk of health care workers who are exposed to TB, hepatitis, HIV, SARS, and hemorrhagic fevers, the need for consistent of guidelines, public health capacity to deal with terrorist attacks. Community health resources are the Center for Disease and Control and Prevention, Health Finder, County of Los Angeles Department of Public Health.